Hi, Lexi. This is Nick from G3 Agency here in Bend, and this is the complimentary video website audit that I promised to you and to Dr. Beard-Irvine. I hope everything is going great for your 2021. I'm going to take the next 5 minutes and walk through your site and give you 3 to 4 things that you can do yourself, or if you want me to help, that will greatly increase your client base through your website presence. So let's get started very quickly. Looking at the site right now, bringing this up, a couple of things I want to point out. You need to have a phone number or some sort of call to action that someone can find in the first few seconds of being on the site. Typically, that's at the top of the site. I see your menu bars down a little bit, which is fine, but a phone number on top would be great. Something else to look at as I scroll down, Google likes content, right? Like right here. This is great. Right now, as far as ranking for search, meaning being in that first, second, or third spot, getting traffic to your site, I'm recommending 2,000 words on the homepage. That's a lot. That'll make you a subject matter expert, and 1,000 on the other pages. So scrolling down here, it's definitely need more content. And then by your phone number, this needs to be what's known as a click to call. So I'm on a mobile device or on my computer, I click it, and I'm there. Let's look at another piece of your site. Let's go to your client services. Right here, newborn 2 weeks, 2 months is time frame that you have. Each of these should be at least a half a page. Definitely more content there. One, it's going to help your visitors make the best decisions. And two, it's going to bring your site up to the top. Images. Google doesn't read images, but it reads what you save them as. So if I say save image as, you could see where it's not really a keyword. You want something like, newborn child care, Pediatrics, Bend, Oregon, etc. I can help you with some of those keywords, but definitely more content here as well. Now, I'm going to flip around really quick and show you something, not particularly in order, because I think you have a great opportunity here for the practice. Now, if I were to type in pediatrician, Bend, Oregon, like I do here, these 3 listings are known as the map pack or Google Map Pack. You're going to get about 20% of your total calls being in this spot, and you do that through the use of citations. Those are essentially the name of the practice, the address, and the phone in different directories, okay? As a comparison, we're going to compare you in a minute to the Copa Kids here, but when I do type in this search, I can very simply click on this tool here, and I'll show you where you're at. So paste that in, and someone does a search for pediatrician, well, either in Bend, Oregon, or typing in Bend, Oregon, you can see your number 16, which is the second page, which is definitely not going to get you any traffic at all. And again, primarily and initially through content is where you're going to get there. And here you are. You can see almost the bottom of the second page. Moving forward, this is a tool called Ahrefs. It's about an $800 a month tool, but it shows me how your site right here is performing, right? So besides content, what makes you rank a site so people find you when they search for terms? Something called backlinks. Backlinks are basically links from other credible sources, perhaps in the same niche, right? In the medical, in the pediatric niche. And then keywords. Looking at keywords, you've got 102, but unfortunately, those keywords are only bringing you 2 people a month to your site. Let's take a look at this. Now, some of these, I think, horse lice picture, some of these may not be exactly what you're going after, right? So what we want to do is we want to look at one of your competitors. Let's pull that up, like Copa here, and see what they're doing, right? And take some of the keywords that they're using and put those in our content, put those in our backlinks. Right here's that click to call that I told you you would have, right? So yes, there's a lot of content here, not great, not any better than yours, but behind the scenes, if we look through Ahrefs here at Copa, 759 backlinks, almost 2,000 keywords, bringing them in over 700 people to their site a month. I'm not saying you're going to get here right away, but can you get there? Yes, over a period of months. Yes, and slowly, and you could scale, most definitely. So let's look at some of their keywords. Now, a lot of their keywords that you see branded with the Copa brand, right? We can still use those in your website to bring people along. not in the content because that wouldn't make sense, but for something called off-page SEO, search engine optimization. But let's look a little bit more. Central Oregon Pediatrics Association, right? Redmond Pediatrics, etc. So that being said, again, with your site, let's kind of give a recap, okay? Here we go. Number one, increase the content on your site. This is a must. 2,000 plus words, as I said, become a subject matter expert at pediatrics, just like you are, right? But you want to put it onto your site. Implementing more backlinks for high volume keywords, right? Such as pediatrician, Bend, Oregon. Right now, you're number 16. You want to be on that first page. It really makes a big difference when you're in that top 5. It doesn't happen overnight. It happens with time, and it happens with the practice, again, of content, backlinks, and keywords. Lastly, we talked about this briefly, citations. That's that map. Different process to do it. Name, address, phone of your practice across various directories. This all being said, Lexi and Dr. Beard-Irvine, just wanted to say thank you for this opportunity. I will follow up with you. If this is something you want us to do, world of difference. Inside of 3 months, you can most definitely increase by a lot the people coming to your site, and then with that content, right, converting them into picking up the phone and calling your office. Thank you very much for this opportunity. Call me if you have any questions at all. Looking forward to talking to you, and I'll call you in the next couple days. Thanks. Bye-bye.